Good afternoon. Once again, today is Monday, the 1st of March, 2021. Happy Monday. First of all, I'll just start with by saying that today is Zero Discrimination Day as arranged by the United Nations. And in this context, in the context of health, it is about not having stigmatization and having empathy towards those affected by COVID. So I'll just recap the Thai language version of the briefing just now by Dr. Tuisin, the spokesperson of the CCSA. First of all, I will talk about the general situation and number of cases that we have for today. We have new confirmed case for today, which is 80 cases, out of which 36 cases are from active case finding. We have 196 new recoveries for today and no additional fatalities. So as you can see on the screen, the number of recoveries is almost reaching. It's running after the number of cumulative cases and almost reaching in the same number. So now we have only around 624 active cases, 624 cases which are still being treated. A very good number compared to the other weeks and the months past, well below 1,000 right now. So just some observations from the presentation of Dr. Tuisin, that the new wave of COVID now is more or less, we can say, under control in Thailand in most areas of the country. However, the infections are still found in certain provinces, such as those related to the fresh market cluster in Pathum Thani and among the migrant workers group in Chonburi and Ratburi. On the fresh markets in particular, there are around over 1,600 or over 1,600 fresh markets in Thailand, and they had been talking about this during the daily CCSA meeting this morning, and the majority of those fresh markets had been cleaned all throughout since the outbreak of COVID already. Now, since we still have certain numbers of cases on a daily basis, we have the vaccines already, but still we have to encourage the general public in Thailand to remain cautious and to remain vigilant and to take seriously and practice DMHTT, the precautions that we have. So D, distancing, M, mask wearing, H, hand washing, T, temperature check, and the other T is Thai Chana Mo Chana application, the contact tracing applications. Now, moving on to the issue of vaccines, vaccine distribution and vaccination, as Dr. Tuisin had summarized just now. So yesterday, on the 28th of February, the Deputy Prime Minister and Public Health Minister, Anutin Charnvirakul, became the first person in the country to get the first jab, the first shot of vaccine against COVID-19, with Prime Minister Prayut Chan-o-cha in attendance. This was held at the Ministry of Public Health, and we rolled out the first vaccinations for the first time after its arrival. Now, as of yesterday, as of the 28th of February, yesterday, 110,000 doses of COVID vaccines have been distributed already to 11 priority provinces: Samut Sakhon, Bangkok, Pathum Thani, Tak, Chiang Mai, as examples. And by this morning, today, 319 medical staff in Samut Sakhon, Nonthaburi, Samut Prakan, Nakhon Pathom have already been vaccinated. So as you can see, the vaccination plan is underway. For the first group, those who are in the front lines and healthcare workers. So far, there has not been any reported case of adverse effects in the inoculation, in the shots administered in Thailand. No adverse effects, side effects yet. And today, more vaccines will be distributed to another 2 provinces, which are Phuket and Surat Thani, including Samui. So, as you can see, our plan is underway, and we will be managing the distribution plan of the vaccines equally, and according to the criteria that we have set for the most at-risk groups and the provinces which are most at risk. As you know, vaccines are not 100% a preventive measure, not necessarily 100%, but to one degree it helps us to prevent the infection. So what is most important is, of course, the most important vaccine for us, of course, is our own measures in keeping with the DMHTT. Now, Dr. Tuisin also mentioned the term exit strategy. It's very welcoming to mention that term, but of course we still have many things we have to do. Now, many countries are not at that point yet. We are not at that point yet as well, but just to plan ahead. So in terms of our strategy looking forward, we would have to be looking at the results of the bubble and seal strategy that we had undertaken in the past 2 weeks in the various important areas such as in Samut Sakhon, in the factories. Now the bubble and seal factories had been practiced for at least 2 weeks already. We'll have to look into the results of those and as well as to look into the results of the antibodies on particular individuals, which will actually take some time. We won't know that result immediately, but rest assured that we will try our best to follow up with all the measures that we have undertaken. As you recall, we had active case finding last month, and the results had been good. We were able to cover the majority of the factories and areas in Samut Sakhon, and had a lot of positive cases were rooted out. Now, most of those positive cases have been treated already, and we have scaled down the active case finding, and the numbers are not as high as in the past week. So that's very, very good to hear. Still, we have to remain very, very vigilant. Now, for today, I'd just like to end by saying that we will be having a virtual seminar called Women in Leadership, Achieving an Equal Future in a COVID-19 World. Now this virtual seminar, you can watch this live on Facebook. It'll be held at the Ministry of Foreign Affairs in cooperation with the United Nations on the 3rd of March 2021, which is this Wednesday. It'll be available for viewing on Facebook Live of the Ministry of Foreign Affairs, Thai MFA, as well as UN Women Asia. So this is a very interesting seminar in which we can learn more about the role and empowering of women in the context of COVID. So just to end today, we will be having the briefing, not every day, as I mentioned last week, only on Mondays, Wednesdays, and Fridays. This is a good sign, but of course all the information, I've been asked quite often where to get the information since the beginning. You can actually get that from the social media page of the COVID Center. It's available in Thai and in English, as well as the Ministry of Foreign Affairs as well. So this is just a brief summary. Please get the information, the detailed information from our various social media pages, and hope that we continue to take care of each other, have empathy on each other. It's Zero Discrimination Day today. We have had the vaccine shots are beginning in Thailand, and rest assured that we'll try our best to take care of all of those who need the vaccines, those who are in the at-risk groups, all the criteria that we have mentioned. We'll do that with full force until the day that we will be seeing no more COVID in Thailand. So thank you very much for your attention, and we'll see you again on Wednesday. Sawadee krap.